Welcome everyone. We're just waiting a few minutes here for more people to join. We'll get started in a few minutes. We'll just wait a few more minutes. Here, people are shuffling into the Zoom, and about one more minute and I'll officially get started. Okay, everyone, thank you so much for coming and welcome. I will get started now, and we'll just kind of let people shuffle in. A few just little logistical things as we get going here. We'll start in a moment, and then I'm planning to speak for about 30-35 minutes. And what I'm speaking about is really a holistic philosophy or a holistic framework that you can apply to your life and yourself. And so once I bring you through that, then I want to lead you through a practice where you can actually play with applying it to something you would like to work with in yourself and your life. So after I speak for about 30-35 minutes, we'll do a practice for about 10 minutes, give or take a few together. And then we will do some Q&A. When you do the Q&A, or if questions come up throughout the webinar, you are welcome to put your questions right into the Q&A tab at the bottom. And we just ask that you please use the Q&A tab and not the chat for questions, because we'll be taking from the Q&A tab at the end and we don't want to miss them. Okay, so welcome again for those of you who are new here. We are about to get going, and what I am going to be speaking to you about tonight or today, depending upon where you are in the world, is a holistic framework that I apply in my own work with, in both my personal life, but much more so professionally. I've been working with people in a healing capacity for about 20 years, and I've worked in a lot of different parts of both in and out of the medical system. And one of the things I've found over time is that, at least in the Western conventional medical model, we have a great way of really compartmentalizing different aspects of ourselves and different aspects of our care. And this can be great when you want someone who's a real specialist in what they do to either diagnose a problem or to give you like a formula or a framework that works for a very specific thing. But what we lose is the ability to see how it all works together. And what I've found after years and years of practice is that when we really work with the self holistically, and for me that means getting the physical, mental, emotional, and spiritual aspects of the self, moving in the same direction, pointed toward the same goal or intention, healing and transformation is miraculous. We can create anything we want. And so what I'm planning to walk you through tonight, which I'm going to give you a visual for in a moment, is what that looks like, how it works, and then how you can apply it to your life. I use the terms health and self interchangeably. And the reason I do this is because when you work holistically, there's really no difference between working with the self, where you're starting to talk about how do I create the career that I want, or the partnership that I want, or something new in my life, versus what we often think about as health in at least Western culture, where we think about like the physical body, our mental well-being. And when I sort of introduce this framework to you, you're going to see that those two things are really the same. When you're looking at the self or health from a full holistic framework, they are the same thing. And there's really no separation between what we're experiencing in our physical body and what we're experiencing emotionally, or our thoughts and beliefs, and the environment around us, our relationships, our careers, our communities. It's all connected. So I'm going to share my screen here and give you a visual of what I'm going to talk about. I will keep this visual up for the entirety of the talk. So if you are, listening in and you're doing your dishes or something else at home while I talk, just keep this visual in your mind and feel free to move about and just listen until about 30 minutes in, when we're going to move into some practical application. And I'd love for you to be able to just sit down and participate. Okay, so we are looking at this diagram here. I think of the circle as you, and this is what I'm referring to as health or self. There are 4 quadrants to self, and the first is the physical. In Western culture, we tend to be very familiar with this part of ourselves, especially when it comes to health. And the way that we connect with this part of ourselves and get feedback about how we're doing in the physical part of ourselves is through sensation, right? So we all have had this experience. Something hurts, something's uncomfortable, and you go in to maybe a doctor, maybe a chiropractor, maybe someone who does body work, but someone who works with the physical body. Or maybe you don't go see someone, but you pick up an over-the-counter medication, or you take an herb, or you change your diet. Regardless, it's through sensation that we get feedback about what's going on in the physical body. And if it doesn't feel good, our attention comes into the body and we prepare to make some adjustments. Most of us are very comfortable, at least conceptually, with this part of ourselves. Then there's the mental part. And what I find, having worked in conventional medicine for many years, is that we tend to lump mental and emotional health into the umbrella of mental health, at least here in the United States. And I actually think we're doing ourselves a huge disservice by doing that. In the way that I look at self, mental health is our thoughts and our beliefs, whereas emotional health is chemistry. This is chemical messengers binding to receptors and bringing about a state that we feel. This is the difference between thinking and feeling. And when it comes to healing and transformation, and even the manifestation practices, trying to create new things in your life, you have to understand the difference between these two things. Feeling emotions is chemistry, which is mediated by the endocrine system. We'll talk about that in a minute. Thinking thoughts is brain and it's nervous system, and we'll talk about that too. Oftentimes these get lumped together because when we are in the emotional experience of the self, just like in the physical, we get feedback from sensation. When we're in the emotional, we get feedback from our feelings. And the mind really likes to understand why. Okay, so if I'm feeling an emotion that doesn't feel good, like sadness, then my rational mind says, well, okay, why am I feeling sad? I want to identify those reasons so I can make some changes in my life and no longer feel sad. Now, the mind interacts with the world through our thoughts. And so much of our thoughts are really where we're putting our attention. I guarantee any one of us on the call right now, we could look around at our lives and we could find things that make us feel joy, people we love, things we're grateful for. We could also find things that we're angry about, things that we feel sad about, things that frustrate us. And the way the mind really works, it's all about where we're putting our attention. Okay, so if I'm feeling sad emotionally, and then my mind wants to figure out why, it will scan my life and it will find some situation, maybe a relationship or a situation that happened that can justify why I'm feeling what I'm feeling. And then as soon as it finds that thing, I put my attention there and it actually creates more of that feeling, right? We've all been here. For example, you're feeling sad and you don't know why, and you start looking at your life and you think, oh, you know, that person that I went on a date with on Friday who didn't text me back. Not that anyone's really going on dates right now, but and then all of a sudden that thing becomes the thing that is making us feel sad. And then when that person finally texts us, we already have this like negative emotion toward them. And then because of the narrative our mind created, we end up like completely blowing the potential relationship because we're already angry or feeling sad about this person's actions when it was simply a narrative that the mind made up to explain a feeling. Feelings are transient. And those of us on the call who menstruate, we all know that like sometimes as a woman, you have a time of the month where you feel sad or you feel down or you feel things and you don't necessarily understand why, and maybe you're scanning your life to find some reasons to explain it, and then your period starts. And you're like, oh, okay, that makes sense. The point being that a negative or a difficult emotional state becomes much heavier when our mind finds something to justify it and puts our attention there. And then we end up creating it over and over and over. And this is where what could have been just like a brief period of sadness becomes depression. So one thing about the mind, so this is how we really use the mind. The mind is really a servant of the heart, and the mind can be used to create the things that we want, or the mind can get in our way. But in order to really use the mind to create what we want, we have to learn to train it. We have to learn to be intentional with our thoughts. And one thing about the mind that's challenging is the mind is almost never present. Its job is to keep us safe. So it is often time traveling into the past, remembering situations that didn't go the way that we planned just to make sure we don't repeat them. Or the mind is like future tripping into the what ifs, anticipating the worst case scenario that could possibly happen just to try and protect us from that becoming a reality. And so when we're in the mind, we're often not present. Healing and transformation can only take place in the present moment. It can't happen in the past, and it can't happen in the future. It has to happen now. And this is why sometimes traditional talk therapy doesn't quite get us the results we want. Because if all we're doing is talking about problems of the mind, using the mind itself, we're rarely in the present. We need to use the physical and the emotional experience to actually get into the present moment. Okay, so then there is the spiritual aspect of the self. And this is really energy. This is what in the world of quantum physics we would call the quantum field. And in the quantum field, there are limitless possibilities, limitless potential. This is material that we can't see, but it is particles vibrating at such a fast rate that they're not visible to the eye. But in the quantum field, what makes one possibility more likely than another is where we put our attention. So the mind becomes very important. And this is sort of where the placebo effect comes in. When we believe that a medication or a supplement or a meditation practice is going to be effective, and then we do it, we're likely going to have better outcomes than the person who does that practice or takes that drug or tries that intervention that doesn't actually believe it. So the spiritual quadrant of self is where we set an intention, okay? And so when we set an intention, we immediately start putting our attention toward that intention. And so the way this works is that when we set our intention on something, and say that's healing my physical body from fatigue, for example, if that is my intention, if I can get the physical component of myself, the mental component of myself, my thoughts and beliefs, and my emotional state, all working toward that intention, the whole system can move. But oftentimes when people come into my practice, they have worked with various practitioners and they've addressed each one of these quadrants in their own way. Maybe they saw a doctor for a physical issue, and maybe they worked with a therapist or a psychiatrist to talk about mental and emotional health. Maybe they worked with an acupuncturist or some sort of energy worker to address the spiritual. But if we're not coordinating the efforts of these four quadrants toward the same goal, we work against ourselves, right? And for example, if someone is working with a doctor on their physical health and they truly believe that part of their path is to change their diet and increase their exercise habits, and the doctor is saying that's not possible, you have to take this cholesterol medication or this blood pressure medication, and then the same person is going to an energy healer that is telling them, you know, you need to eliminate these foods, or you need to take this supplement, or you need to try this yoga practice, and then they're going to a mental health practitioner who is helping them understand their values and what they really believe to be true. And then every time they go to put that cholesterol medication in their body, something feels off. They feel angry or they feel frustrated because it's not actually the way they want to treat themselves. The system can't move. There are too many oppositional forces. So what we want to do, what I do in my practice, is I understand the goal, and whether that goal is I want to heal my chronic fatigue or I want to meet my soulmate. It doesn't matter. When we're working holistically, either way, we need to get all four quadrants of the self pointed toward the same goal. So just like in the physical and the emotional quadrants, you see the arrows pointing inward here. We take in the outside world through sensation and feelings. Okay, our experience, physical and emotional experience, draws us inward. We do some introspection, we kind of listen to the inner voice, and we make a decision about what needs to shift, to heal, or to create, or to transform, or whatever it is that we desire. And then we project out with our thoughts and our language and our energy and our intention. We project that out into the world, and this is actually how we start to create our lives. This impacts our relationships, our careers, our work environments, our communities, our homes, everything around us. So it's this constant dance between us taking the environment in and then creating it. Okay, and just like the heart can't expel blood to the distant parts of the body if it doesn't take it back, and we can't inhale without exhaling, the holistic nature of self has to have reciprocity. We have to have an exchange of energy. So we take things in through the physical and the emotional, and we project things out through the mental and the spiritual. A few little notes on the diagram before we actually get into it. This side of the diagram, historically, and at least in the United States, we tend to be more comfortable with these terms and with these components of ourselves. These are what we would call in Chinese medicine the yang or the masculine principle. Right? This is like the stuff that the rational mind can understand. This is data. This is lab work. This is what we can see. And this side of the diagram is where a lot of us are much less comfortable, because this is the unseeable. This is the yin in Chinese medicine or Taoism. This is the feminine principle. And it requires trust. It requires us to trust that even if the rational mind can't understand something, it's still happening. So for example, if you are working toward creating your dream life, or you're working toward creating your healing in your body, and you're not seeing anything, this principle invites you to trust that every single one of your efforts, every thought, every intention, where you're putting your intention, it is not going to go unseen. But you have to sit in the void a little bit. And part of the work is transcending the doubt and trusting that where you put your energy matters. And you will see results. But just as I said, the mental quadrant of the self is rarely present. It's usually in the past and the future. The physical and the emotional parts of our experience are in the present moment, right? Your physical body cannot time travel. It's here, now. Emotions too. We feel them in the moment, and they pass actually quite quickly if our mind doesn't get involved. And then the spiritual quadrant is timeless. So when we're here in the land of spirit, past, present, and future don't exist. And this is when, if you've heard people talking about inner child work, this is what we're talking about. Something that happened to you as a child that may have been unresolved. In like your spiritual body and the spiritual component of yourself, that still exists because time doesn't exist here. So, whereas here, this is the part of us that likes to say, okay, I'm going to try this new dietary approach, and it's going to take 3 months to see results. And as a medical provider, there are tons of things that I can tell you that about, right? I can tell you, like, if you start taking, changing your diet today, I can check your blood sugar levels in 3 months and we should see change, right? We know timelines over here. Over here, we really don't. And so if you've ever been on like a growth path or a healing path, and you've had one of those moments where you've said, I feel like I'm being tested, you're not really being tested, but you're over here. It's really an invitation to trust yourself, to commit to what you are already doing, and know that eventually, and we know there's no guarantees on the timeline, but your efforts will not go unseen. And the test is sort of, can you let the trust fuel your commitment as opposed to letting the doubt shut down your efforts? And if anyone here has ever really like dove into a yoga practice or an exercise practice, a lot of the time we start a practice like that with a goal of, if I do this every day, my anxiety will improve. If I do this every day, I'll lose weight. There's some goal, but then somewhere along the way, we fall in love with the actual practice itself, and it becomes habit. And we actually forget about the goal. The goal just happens naturally. And that's a lot of like the nature of this side of the work. When we are healing and growing, we need a balance of yin and yang. Health is balance. And what that means is that if you're a type A and you're always trying a new diet or a new supplement or training for an Ironman, then you may be a little imbalanced in this direction. This is the doing. Whereas this, the yin, is the being. And living your life in the doing constantly is sort of like living your life creating financial wealth and then never spending a dollar, right? There's no point in healing if we don't actually enjoy the experience of being healed. So much of this work when you're in a holistic system is finding that balance of like, when do I push? When do I really like move through the resistance, that voice that says, I don't want to go running this morning? When do I move through that? And when do I be gentle with myself? When do I actually just let myself enjoy the silence and a pause and actually integrate all the work that I've done? It's just as important, okay? And then the last piece of this diagram is what you see up here and down here, the nervous system and the endocrine system. And these are really the two systems of our body that are sort of like the doorway between the outside world and the inner world. The nervous system is like our electricity. Our nervous system is constantly scanning the environment and deciding if we're safe or if we're under threat. If we're under threat, our fight or flight response is immediately activated. And that has an impact on the body. When we go into fight or flight, the physical body is impacted, meaning that blood flow to the digestive organs and the reproductive organs slows down. The pupils dilate. We pump blood flow to the musculoskeletal system so we can flee or fight or freeze. And then the endocrine system takes that signal and it turns it into chemistry. So in the case of fight or flight, this is adrenaline, this is cortisol, this is the feeling of anxiety, right? And then the mind starts racing. How can I keep myself safe? We go into survival mode. This is not where you heal. This is not where you grow. This is not where you can experience quantum leaps in your creativity and manifestation of your dreams. Okay, and then the opposite branch of the nervous system is the parasympathetic branch. So when we scan the environment and we feel safe, then we can be calm. And the branch of the nervous system we turn on is the one that I like to call rest and digest, or feed and breathe. This is where healing takes place. So when we're using this formula, this framework, it's very important to start out by creating safety for yourself, really getting into that relaxed state. And I'm going to teach you a tool to do that using your musculoskeletal system, so you can send a signal to your brain that you're safe, you're calm. This is where we do our best work. And when the nervous system is in this state, Then we get the good chemistry in the body. This is where we get the oxytocin and the dopamine and the serotonin, the feel-good chemicals. And those have their own impacts on the body, right? So through these two systems, we impact all four quadrants. What I find in my practice is when I look at what's going on holistically, and when someone is not well or feels blocked somewhere in their life, there is usually a theme that I can identify. And in my practice, I often work a lot with the chakra system, and I use the 7 chakras to understand different universal human themes. And once I can identify the theme of dysfunction, I can see it weave its way through the 4 different quadrants. So for example, let's just take a very common theme, the theme of feeling unsafe in the world. If we feel unsafe in the world, emotionally, most of us experience that as anxiety, and probably everyone on the call has experienced that at some point or another. However, then sometimes we do some work, maybe with meditation or therapy, and we sort of feel like we get to the root of the anxiety and we feel better. But if we haven't fully gotten to the roots of this theme of not feeling safe in the world, we might see it shift into another quadrant. In the physical body, what this might look like is an autoimmune condition. This could be allergies, this could be skin conditions, right? So how we might see this on the physical body is the immune system or the skin, which are both protective systems of the body. They may be confused about what is safe and what is not. And in the case of allergies, we'll have our immune system reacting to pollens in the air or trees or grasses, maybe foods, things that we don't actually want it to react to. And in a more severe case, we might see the immune system react to the body itself, which is an autoimmune condition. Other things I often see with the theme of unsafety, I see people being overweight or obesity that just like doesn't seem to respond to any of the normal methods, right? Dietary changes, exercise, lifestyle changes. If someone does not feel safe, sometimes in the physical body, they're carrying extra weight to actually protect themselves. There's an actual barrier between their inner organs and the world. Right? And feeling unsafe in the mental part of the self really is like a belief that things are not going to be okay. It's a belief that everything is going to always turn out the worst case scenario, right? So then our mind and our thought processes and our beliefs, they keep fueling the feeling of anxiety. And then lastly, this could be a spiritual crisis. And what it often looks like spiritually, if someone really feels unsafe in the world, is like not really going for their dreams in their life, right? So then rather than setting an intention and focusing our attention on that amazing thing that we want, we stay small, right? Because it's safe and we feel more protected if we stay small. So rather than quitting that corporate job that like I've hated for 30 years, I just stay in it because I feel safe there. And so part of my work and part of my superpower is helping people identify what is the theme of dysfunction. And once we identify it, then rather than going from doctor to therapist to energy healer to psychiatrist, we can actually get at the root of the theme. And then rather than spending 10 years chasing it through different aspects of the self, we can actually heal it. So for me, working holistically in this way is the only way to create sustainable, lasting healing and transformation. If we don't work with all parts of the self, it's all temporary. Okay, So I am going to stop my screen share shortly here, and we are going to move into a little practice where we experience this and actually do a direct application of like what a practice using this might look like to create something you want. So as I stop sharing my screen, I invite you to get in a comfortable position, like whether you want to sit on a chair, you could lie down, but it's going to be a little bit of a meditative exercise. And if you're already comfortable where you are, I invite you to think of an intention. So if you're not sure what your intention is, think of something that you want to create. Okay, so it could be something you want to heal in your body. It could be something you want to create in your life. It could be just something you want to see in the future, what life post-quarantine looks like. Okay, and I cannot see you all, so I'm just going to give you one more minute to get comfortable here. Okay, so wherever you are, whether you're sitting or lying, I just invite you to close your eyes. And let's all take a nice deep breath in through the nose together, filling your lungs completely and holding your breath at the top for 3, 2, 1, and exhaling with a sigh out your mouth. And let's do a few more of those. So it's breathing in through the nose deeply, holding the breath at the top, and then letting it out with a sigh. When you make a sigh and you actually make some noise, you're actually starting to tone the vagus nerve. I think of the vagus nerve as the freeway between the mind and the body. So you're really starting to tone that relationship, strengthen that relationship, and helping move into a more parasympathetic or relaxed state. So just one more there, nice deep inhale through the nose, holding at the top, and exhaling out with a sigh. And then just letting the breath be natural, moving in and out of the nose, keeping the eyes closed. And take a moment and just notice if there's anything in your body that feels uncomfortable right now, that you need to adjust or move. And if so, just tend to it. And then I invite you all to bring your attention to your feet. Just notice your feet. And on your next inhale, I invite you to tense up and engage all of the muscles of your feet for 3, 2, 1. And on your exhale, just releasing and relaxing all of the muscles of your feet. Feeling the tension just drain out of your feet. Next, bring your attention up into your lower legs, just noticing your lower legs. And on your next inhale, engage, maybe by pointing the toes or pulling the toes back toward your head, engage all of the muscles of those lower legs for 3, 2, 1. And on your exhale, just relax and release all of the muscles of the lower legs, letting the tension drain out your legs into the surface beneath you. Next, trace your attention up into your thighs. On your inhale, engaging all of the muscles of your thighs for 3, 2, 1, and on the exhale, relaxing all of the muscles of the thighs and just letting the tension drain out of your entire legs. Trace the energy up, feeling the muscles now of the pelvic floor and the butt and the abdomen. And on your next inhale, engaging all of those muscles, clenching the muscles of the pelvic floor, pulling the abdomen in toward the spine, tightening up the butt for 3, 2, 1. And on the exhale, just relaxing completely and letting all of the tension drain out of the core. Next, bring your attention to your arms and your chest. And on your inhale, clench your fists, pull your arms in toward your body, and engage all of the muscles of your arms and chest. Contracting the chest for 3, 2, 1. And on the exhale, let it all go. Take another breath cycle, relaxed here, and just let the air open up the chest, expanding the chest, relaxing the muscles of the chest and the arms and the hands. And then bring your attention up to your shoulders. On your next inhale breath, inhale your shoulders up to your ears, clench them tight for 3, 2, 1. And on the exhale, just release and relax the muscles of the shoulders. And lastly, bring your attention to the muscles of the face. And on your next inhale, I invite you to tightly shut the eyes, scrunch up your forehead, tighten the jaw, bite down for 3, 2, 1. And on your exhale, just relax all of the muscles of the face and just let that sense of relaxation move into your head, your scalp, your shoulders, your neck, your chest, your abdomen, your back, your pelvis, your arms, your hands, your butt, your thighs, your lower legs, your feet. Just let this wave of relaxation fill you completely. You're using your musculoskeletal system here to send a message to your brain that says you are safe. You're preparing the self for healing and growth as you enter this parasympathetic state more deeply and deeply. So we're using the physical body to impact the system. And from here, I invite you to remember your intention. What is it that you would like to create for yourself? And I invite you to visualize that. Whatever you can see, whatever details you know about this goal, this intention, just visualize it as if there's a movie screen on the inside of your forehead. Gaze your eyes at the screen and visualize this intention. Keeping your focus here, your attention completely on this visualization for 30 seconds. 30 seconds, we will not let the mind travel elsewhere. And if it begins to, your job is to bring your attention back to this screen on the inside of your forehead. Watching your own movie, your own imagination, your intention. And then actually use the mind for a moment to think about it. When this intention is real in the present moment, what are you thinking? What are the thoughts? If it's about your health, perhaps I am healthy. If it's about your love life, perhaps I am in love. We now have our intention, our attention, and our thoughts all coordinated. Next, I invite you to generate the feelings, the emotions that this intention actually creates for you. So when this visualization is real, when you are living this, what do you feel? I invite you to feel those feelings now. Perhaps it's joy, excitement, gratitude, pride. Feel those feelings as they come into your heart. Feel those feelings as your heart generates them. Allow the feelings to fill the field around your body as well as your body. Next, I invite you to think of a statement where you can use your language to actually transmit this visualization into reality through vibration. So perhaps you take one of those thoughts, I am healthy, I am happy, I trust myself, I am in love. And if you can, wherever you are, just make a statement out loud 3 times. Try to use present declarative statements, I am or I have, as if this intention is reality in the present moment. This is how we work with the spiritual quadrant of self. We have to speak in the present. And lastly, I invite you to consider one action step you can take in your life that is in service to the creation of this intention. Perhaps it's making a dietary change. Perhaps it's reaching out to someone you haven't spoken in a while. What is one action, as simple as it may be, that you can take today or tomorrow? And now we have our intention, our attention, our thoughts, our feelings, our language, and our actions all directed toward the same place. With this formula, you are an unstoppable force of change. You can create anything you want for yourself. Let's all take a deep inhale in together through the nose, holding the breath at the top, acknowledging yourself for taking this time and your efforts, and exhaling with a sigh through the mouth. One more, inhaling in your intention. Holding at the top and exhaling out any doubt that's in your way. And final breath, inhaling in, complete trust in yourself to create and heal and transform and grow in whatever direction you desire, holding at the top for 3, 2, 1, and exhaling out anything that's in your way. And then I invite you to open your eyes and come back to the call. And we have about 10 minutes left, and I will just open it up for any questions. It looks like we already have a few. So I'm just going to start going through them. Can you please share the presentation afterwards? Absolutely. I also post this on my Instagram a lot, and it's there all the time too. It's Experience 7 Senses, and that is also listed on the event page. How can we decrease our negative thoughts? Great question. You know, decreasing negative thoughts is really about, it's a training process, right? So we have negative thoughts. We also have positive thoughts. And where you focus is like what seems to dominate, right? So the first step would be to start identifying some of your positive thoughts. Start putting some attention on them, right? And the more you put attention on the positive thoughts, the more aware you will become when your mind is drifting into the negative thoughts. And then you can catch yourself and you can reframe. But this is a practice. It takes so long, and it's just coming back to it over and over and over again. Can meditation fix the endocrine system? It can absolutely impact the endocrine system. Personally, I don't love the term fix because I don't like the idea that anything is broken in the first place. But yes, meditation, Kundalini yoga is one of my favorite tools to actually really work on the endocrine system. And pretty much all meditation practices are more directly working with the nervous system, and via the nervous system, you're impacting the endocrine system. But the endocrine system is also a big system. It's, you know, you're talking about all your hormones and all the glands of the body. So meditation can help. And, you know, if I were working with someone with this question one-on-one, we would probably get quite a bit more specific with that and actually like how we wanted to use meditation as well as other tools. Okay, so, let's see. What's your take on the emotional freedom technique? Is it really efficient as a healing method? You know, we all have our own medicines. EFT, I have some experience with it. Earlier in my career, I took classes. I tried it with a lot of patients. It didn't quite stick for me. It wasn't one of the tools where I saw dramatic changes. So I sort of let that one go for my tool bag, but that doesn't mean it's not an effective tool. It just means it's like, it wasn't really a medicine that worked for me as a practitioner or for my patients and clients. What are your thoughts on vision boards? This is the second time someone's asked me this question this week. I think it's a great way to really work with that visualization technique. Basically, I mentioned earlier, I use the chakra system a lot in my work and sort of as a way to put language to energy. What we're working with in this spiritual part of ourselves really is the third eye chakra. And the great gift of the third eye chakra is imagination. And when we use imagination or intention or visualization, a vision board can be a great way to actually start like creating a picture for the mind to work with and focus on. So I think it's great. How many times per week should I be meditating? It really depends on your goals. You know, there's not really a universal answer to this, but what I would hope is the more you meditate, the more you can actually answer this question for yourself, because you experience how it impacts you, and you become conscious and aware of how the practice is changing your life, and you can sort of fine tune what your needs are and when and how you want to use the practice. How do I go about several intentions, starting with the meditative practice? Then what is next? I'm not sure I totally understand the question, but you can do this with as many intentions as you want, but I wouldn't try and do them all at the same time. Okay, so one way is to take each intention on its own and do practices for that. Maybe you're spending the next few months focusing on one intention, and then you'll move on to another one. Another way to try and put them together is to use the emotional quadrant, is to say, well, I have this intention in my career and this intention in my health and this intention in my relationship. But like at the end of the day, what they all do is they make me feel joy. So then maybe I shift my intention to creating more joy in my life. And then I let go of the details of what I think that looks like in my work and my home and my relationship. And I just focus on the feeling. Okay, let's see. What can someone who has had a traumatic childhood and adolescence do to feel more safe and resolve overweight issues? You know, as a general rule, in my work, in my practice, I mentioned how I use the chakra system, and what we're talking about here is root chakra issues. We're saying like the root chakra, really the base of our energy system, this is really about survival. And this is about like really living from a place of not feeling safe. And so oftentimes in this situation, I might work with someone on some root chakra practices, right? Because then we're working in the spiritual quadrant of self, where we can go to a different time and address that trauma that is still present. And so one example of this is a grounding meditation, where you visualize the roots of a tree extending from the base of your spine deep into the center of the earth. Another one is getting present into the physical body, really using the senses. So whenever your mind is tripping on something, a great practice is just to get in your body and use your senses. What is one thing I can touch or feel? Can I identify a sound that I can hear? Something I can smell? Is there something I can taste? This is a great way to start the process of getting grounded, which would be probably a big part of the healing for someone who has had a traumatic childhood and adolescence and wants to build that feeling of safety. Yes, I offer holistic healing remotely. Yes, in fact, right now I'm doing all my work remotely. So yes, I do it all over Zoom, which we're on now, and you can find that through my website. We're also going to send out a follow-up email, and I'm going to offer a discounted rate for anyone who is on the call today, or Small World members, and I'm happy to dive in deeper with any of you. Can meditation help with the healing process and physical pain after an injury? Absolutely. But again, we have to think about like really making sure we're getting, like, how are we using meditation? We're often using meditation to get the mind present And what I just want to make sure is we're choosing a type of meditation and a way of using it that is truly holistic, right? Because if we're talking about physical pain after an injury, it's manifesting in the physical quadrant of self. So that doesn't mean that meditation isn't a great tool, but I want to make sure that we've got the physical, the mental, the emotional, and the spiritual all touched by whatever that meditation practice is. Okay, do you work on multiple chakras daily with your clients or parse them out over several days? Mostly with my clients, I parse them out. Most people I work with, I see every other week. And so much of the chakra work, we really need to we need to incorporate some practices, awareness, and get some feedback from our lives as to what's changing. I'm a really big proponent of actually seeing change in real time when I'm working with people. So I like to leave enough time between our sessions to get some feedback from their lives. With that said, I also do 7-day retreats where we go through each chakra per day, and it's more of an intensive. Okay, I want to be respectful of time here. Maybe I will take one more. And let's see here. Different futures and different pasts exist at the same time. How can we influence better which one we want to connect with and recognize them better? What a beautiful question. And I totally agree with you. And again here, this is the quantum field, right? So every single infinite potentials exist. And what really makes one more likely than another is where you put your attention. So this is about you identifying which one you want to connect with, and really using these tools to focus on that reality, and that becomes the reality in which you're living in. Right? And so time is a very interesting thing with this work, right? Because when we're working it spiritually, there is no past, present, and future. Yet what you're saying is actually absolutely correct. Different futures and different pasts exist. And this is why when we did the practice, I directed you to use a statement that's in the present tense. I always used to think it sounded a little cheesy in these New Age circles when everyone was making I am statements. But this is why. Because if I state one day when I'm a billionaire, the present moment translation of that is I'm not a billionaire. And if I actually want to be a billionaire in the future, I need to make the statement as if it's true now. So I make the statement, I am a billionaire. And by making a statement in the present, I create that in the future. So this time thing it can feel very complex, but at the end of the day, it's where you put your attention. Okay. I guess I'm happy here to take a few more if that's okay. And if we need to wrap up, we will wrap up. I can take a few more. Okay, great. I'll take a few more. So let's see here. I'll try and take something a little bit different. How long does it take for a treatment on average? See, this is a really good question because time is interesting. So I'd say in my work, it really depends what we're working on. If the goal is to change something in the physical body, then we are bound by the laws of, the 3D material world here. Okay, so if we're trying to heal someone's digestive system, I'm actually thinking about what is the cellular turnover rate, what is the time it takes to build a new digestive lining? And that's about 3 months, right? Whereas if we're working on, so basically what I'm trying to say is when we're working on a goal that lies in the physical quadrant, personally, having a lot of experience with health and medicine, I can usually answer this question with confidence. This is how long this should take. When we're dealing with mental, emotional, and spiritual phenomena, time is much grayer. And this is where we could have a quantum leap. I have people who do one session with me and they feel like they have a new perspective that impacts every area of their life and health. And it's like, feels like a miracle. And I have people that are really stuck in a process. And like I said, we can see this theme weave its way through the mental to the emotional to the physical, right? And sometimes when we're chasing a theme like that, it can take a long time. So it really depends on what we're working with. And just like I said earlier, you know, in healing, we have to balance the yin and the yang. And as a practitioner, I need to balance that too. So the yang part of me really likes to be able to tell you, I've seen this particular issue 1,000 times and I know how long it takes, right? And for me, I have to balance my agenda and my experience and my knowledge and my rational mind with like the mystery of healing. The fact that like you may be the one in thousands that has a different experience. And the last thing I want to do is invalidate your timeline, because your timeline is perfect. Your timeline is your own timeline. And I'm here to support it in whatever that is. So it's, you know, it's a dance. This stuff is a dance when you're truly staying in a holistic framework and really working in integrity with it. Sometimes it's disappointing because we like to know why, and we like to know how long, and we like guarantees. And there's an element of healing that just, it's mysterious. And the beauty of the mystery is that more often than not, people outlive a prognosis. More often than not, conventional medicine uses the mind to lower expectations, and we do better than we were told. And so the beauty of the mystery is that oftentimes it's a miraculous surprise. And the hard part about the mystery is it requires us to trust. And it requires us to get comfortable with the like, I don't know. So that's my answer to that. How do you get in touch with me? You can get in touch through the website. You can just send, there's a contact me button. You can also, I'm pretty active on Instagram. It's @experience7. So she wrote it already in the chat here. Feel free to send me a message there too. Okay, well, I will officially, would it be possible to have the meditation as a video or audio? I believe they're recording this and going to distribute it, so absolutely. I also lead practices every Sunday. They're on at 11 o'clock Eastern time, where we actually do a 2-hour practice, and you really sort of get a taste of like a 2-hour experience where you're engaging with the physical, the mental, the emotional, and the spiritual. So, okay, great. I hope to connect with many of you in the future. And thank you so much for participating and being a part of this and welcoming me. Goodbye.